South Korea has been lauded as the world standard in how to deal with COVID-19. South Korea has managed to keep the death rates fairly low and slow in terms of the spread of the virus, all the while avoiding a lockdown altogether. So are there any lessons that we can learn from Seoul, and are lockdowns inevitable? Well, joining me now is His Excellency Choi Yeonghan, the Ambassador of the Republic of Korea to the Republic of Kenya. And thank you very much for speaking to us, Ambassador, today. How did South Korea deal with COVID-19?
Well, thank you for inviting me to this program. Well, Korea's COVID-19 control strategy can be described with 3 words. That is test, trace, and treatment. Regarding the test, from the beginning, Korea did robust and exhaustive diagnostic testing with around 440,000 cases so far, averaging 20,000 tests per day. This was made possible by fast-track authorization of test kits produced by biotech companies in Korea and efficient networking of public and private institutions capable of testing at scale. Currently, the tests are conducted at 118 testing institutions across the country. To cut needed time for sample taking and further limit exposure of frontline medical workers as well as those who are waiting to be tested, our medical community pioneered drive-through testing stations, allowing drivers to go through the process of registration and specimen collection in under 10 minutes without needing to get out of their vehicles. As of late March, there are 79 drive-through testing stations in operation nationwide. And a number of private hospitals have adopted a phone booth type testing facility that enables rapid walkthrough of potential patients while protecting frontline medical workers who collect specimens behind clear acrylic panels. Regarding tracing, the Korean government is vigorously tracking and testing those who had been in contact with confirmed cases, utilizing credit card transaction history, CCTV footage, and mobile phone GPS data when necessary. Of course, within the scope of our domestic law. Relevant anonymized information is disclosed to the public with due care to protect personal information so that those who may have crossed paths with confirmed cases may get themselves tested.
Ambassador, if you can hear me, and thank you for that. But why did your country then decide a lockdown was not necessary in the style in which other countries have done it, for instance, China or even now Italy?
Well, the principle of Korean government is open and transparent response with minimal interference in traffic. But that has been possible because the Korean government is fully committed to sharing information on developments in this situation in a prompt and transparent manner. In our fight against COVID-19, the Korean government is committed to complying with WHO recommendations on border control. That measures need to be proportionate to the public health risk, be short in duration, and be reconsidered regularly as situation evolves.
All right. And finally, as a partner of Kenya and noting our social economic challenges, would it be your advice to the Kenyan government to lock down the country in order to contain COVID-19?
Well, frankly, I'm not an expert in this issue to advise anything to Kenyan government. All I can say at this moment is every country has its own conditions and environment, and every policy options has its own pros and cons according to the domestic situations. So I believe, and I'm quite sure, that the Kenyan government will find out the most appropriate measures based on the current situations of Kenya.
Thank you very much, Excellency, for your time, and all the best to your people as the entire world battles COVID-19.
Thank you very much.
Thank you. And that's our time there. We are, of course, going to continue with our extended coverage of this COVID-19 scenario. And when we return, we continue with that debate to lock down or not to lock down Kenya. What is the best route? We're back after this.